et cetera. I'm not a real big car buff, but at the end of the day, I know that if I got a 30,000 mile maintenance due on my car, I'm looking at a $300, $350, $400 bill, depending on what they do. I don't expect to go there and pay $15.
Right.
And I value it accordingly. And I prioritize it accordingly, and I save for it accordingly, because you know that if you're using the car, the tires are going to run out or wear out, and et cetera, et cetera. That behavior is not instilled with the way that the consumers are trained by the insurance companies. Now, let's just talk about the insurance companies, the nature of an insurance company. The fallacy of the insurance company is when you're in a three-way transaction, the guy that's adding the least amount of value, which is in this case the insurer, okay, it's a very, very tough situation for the consumer, which is us, because what are they really trying to do? The insurance company's entire reason for being on this earth is to suck as much money out of your pocket as they can and give you back as little as you can. And you have no leverage.
Right.
And the problem is when you lose the leverage, you lose the causal connection, the cause and effect to the services that are being rendered. So if you're painting my house, okay, and you're telling me you're going to charge me $800 to pay the house, and you do a rotten job painting the house, then I'm either going to say, hey, you got to redo it, or I'm going to pay you $500 and tell you to go away, or something in between. But the problem here is the insurance companies are taking your money, the doctors are performing the service, and then the doctors are billing you, and the insurance companies are saying, well, I'm not paying for that. And you have no leverage at this point. The guy performed his service. He wants to get paid. The insurance company that took your money, not willing to cough it up, and you have no leverage against it. So that's the other problem with insurance, and just how they're motivated and how they're incented. Now, compare that to if you contracted directly with the providers of the service. So if you had a insurance policy that was New England-based hospitals, just as an example, and you went over to a particular doctor and had a certain procedure performed on you, and you weren't happy with that procedure, or you felt that the procedure was overcharged, or you felt whatever, you would have the ability to go back to them and say, hey, I don't agree with this bill. I don't agree with this procedure. I wasn't happy with the result, whatever. But you as a consumer are empowered. So there's a whole nother area. And again, these are very simple and easy implementations to solve these problems. And yet they don't see the light of day, because fundamentally the Democrats, as we talked about, are totally committed to a communist state, and the Republicans have long since run out of ideas. And that's what we're trying to do here, is throw some of these different ways of looking at things so someone has the ability to kind of look at these and go, wow, that does make sense. That's right. Okay, we can use these arguments and use some of these and smash some of these premises that they're basing their actions on to stop them. So because if we don't come up with answers to stop it, we are going to lose everything that has been of value in this country for the last 200 years.
Yeah, it makes me think, like, when you're talking about the insurance companies, does it make more sense then to have just a catastrophic type of insurance type of coverage, so that you have a smaller scope as to where the insurance company gets involved, and then pay for, say, the smaller stuff, like out of pocket? Like, is it going more towards the car insurance model, where, the car insurance, they don't really have anything to do with you putting, gas in the car or doing the maintenance on the car, but if you slam into a telephone pole, then that's when the insurance company really starts to get involved.
That is exactly the way it should be. That's right, because it is that exception, it's that catastrophic event or unforeseen event, or whatever the particular is. But the day-to-day maintenance of a human being's life is something that I presume they should value. And if they don't, well, that's good that they don't, because they won't be around anyhow. And we don't want people that don't value it around anyhow. But fact of the matter.
Well, I mean, plus the other point that I was trying to make is that you have more choice. Like, many of the insurance companies that you deal with will essentially say you can only pick from X amount of doctors, and you can't go to this one particular specialist without a referral and all this other stuff. Like, it seems like it's very much about trying not necessarily on getting the best health care for you, but in terms of managing their like there's a whole set of doctors that they've already got a negotiated rate with, and they want to make sure you go there, as opposed to, say, if you find a better doctor that's outside of your network, it's more difficult for you, more expensive for you.
That's right. Some of it is for cost containment, but it's at the expense of customer choice, and in many instances, unfortunately, it's at the expense of the quality of service that you're going to receive. And I think that's a really good point. I think I want to inject one thing before we go down that path, because I think I just want to make another point really clear. This whole healthcare, because these terms are not defined, and because a lot of the basic underlying principles are not really evaluated, what exactly are we talking about from a deliverable standpoint? If healthcare is a right, and everyone is apparently, including this Miss Fang that was on the television that you just played, feels that it's a right, well, then why don't we have the right to a LASIK surgery? I mean, that's a doctor procedure.
Mm-hmm.
Or how about breast implants? I mean, I think every woman should have the right to have, the size breast that she deems appropriate. So why don't we include breast implants or liposuction? I mean, geez, I think everybody should be entitled to have liposuction. Why stop there? In fact, if someone is sick and they realize that in the wintertime, because the heat's running and all that, it's causing havoc with their sinuses and stuff like that, why don't we include a trip to Florida for the winter? I mean, where does it Well, if you think I'm making light of this in one extent, but I'm very serious in the other, because once you open up this Pandora's box, the answer is it doesn't stop.
Well, right.
You will see people going to Florida on the grounds of they have a right to health care, unless you drive a stake in the ground and say, no, you don't have a right to health care.
And just as an aside, that specific example actually just came out of Europe, out of Brussels. The let's see, just quoting here from the story, Brussels declares vacation time a human right. The idea for subsidized tours is the brainchild of Antonio Tajani, the European Union Commissioner for Enterprise and Industry, who was appointed by Berlusconi, the Italian Prime Minister. And then also, here's another thing that's funny, just the next paragraph down. Tajani, who unveiled his plan last week at the ministerial conference in Madrid, believes the days when holidays were a luxury have gone. Traveling for tourism today is a right. The way we spend our holidays is a formidable indicator of our quality of life. This is off of FoxNews.com. I mean, this is insane. We said that jokingly, and this is actually the logical conclusion. The logical conclusion is everything. If you have a faulty premise saying, this is a right and that's a right and this is a right, you have to literally go to I have the right to everything, because there's no end to it.
Or we could take a step back, and if we use our definition of a right, then in fact today everyone has health care. Everyone has the right to health care, because today doctors are allowed to practice the way they choose and charge the rates they want, and you have the right to go to them or not. I realize it's limited because of insurance, but fundamentally, there, as opposed to some government decree or some government certificate that allows you to go to the doctors, which would be the alternative, right? So in reality, you do have health care as a right. You have the right to pursue, you have the right to take action to acquire health care to better your life. And that is the proper role. So right, the real irony of this is that this is very typical, especially today, and especially when you're dealing with unprincipled organizations like the Republican Party. They take an idea or a term and they completely, it's so perverted that it's lost all meaning, when in fact they do have the right to health care. And that should have been the argument. We already have that. Next.
Okay, well, I mean, so right, we have the right to pursue the health care. We have the right to go and pick the doctor that we want. We have the right to, or if we want to become a doctor ourselves, we have that right. But the difference is having the right to pursue is fundamentally different than the right to receive. from somebody else.
That's right. That's right.